Oh, hi there. Just make yourself comfortable. So, my nurse has brought you through and you're here for a dental extraction today. Yeah? Okay. So, you've filled out your questionnaire on the iPad in reception, so that's just coming through to me now. So, just need to check a couple of things. So, it's been a while since you visited your doctor. Yeah? Okay. Dentist, we saw you recently, obviously. You're not on any other medication, that's fine. And no allergies that you're aware of. Have you had lidocaine before? You have. Were you fine with that? Good, good, good. Okay. That's perfect. Do you smoke at all? No. Okay. Do you drink alcohol? Right. And you've taken no medications at all this morning? Okay, perfect. Right. Okay, so as we discussed on your last visit, you have a condition called periodontitis, and basically that means a nasty bacterial infection is attacking the gums and it will eventually attack the bone around the teeth and it will lead to bone and tooth loss. And what's happened is a particularly bad area has attacked the area, the bone around the tooth. Your tooth is now coming loose and we need to get rid of it. We are treating the infection for you. Okay, and your hygienist will be seeing you again very shortly. Yeah, but you are aware of that's what's going on. Okay, that's fine. So, what I'll need to do first is just have a little look around your mouth before I do anything. Alright, just to check there's nothing else that's looking a bit loose or, a little bit too sore for me to work around today. Okay? Alright, my lovely. Don't you worry. Most people are anxious at the dentist, but I'm here to help you, and you can tell me to stop at any time if anything's uncomfortable, but we'll do everything we can to make sure that you're nice and comfortable and in no pain at all. Alright? Okay, so let's just pop some gloves on. Things will feel much better once we get that loose tooth out as well and get to that infection. Alright, so just going to pop a cover around you. Okay, just need to reach in and pop this on. Okay. There we go. Alright, that's fine. There. That'll keep you all nice and covered up. Okay. Just grab a couple of tools here. So I'm just going to be having a look around your mouth, right, with my mirror. So open nice and wide for me, my lovely. Okay. Just using this for now. Okay. So firstly I'm going to look at the area of the tooth that I'm going to be extracting. Alright. Nice and wide. Perfect. Okay. Alright. So we can see that tooth there. It's ready to come out. And the inflammation and infection around that area. Okay. Just having a little look all around there. Okay. Oh. Just going to be using a tool just to gently have a little tap around, okay? This won't hurt you, but tell me if anything does feel uncomfortable, okay? Okay. It's alright for you, my lovely. Okay. Just gently tapping on these teeth. nice and wide again, thank you. Okay, just relax there. Okay, could you just open your jaw nice and wide for me when I've placed my hands on the side there, okay? Okay? Alright. Does that feel alright? I can't feel any clicking. Okay, could you move your jaw side to side for me? Okay, just got a little feel underneath your chin. Just feeling for any swollen nodes. A little bit of swelling on this side, but that's where we're taking out that tooth, and I think it's the infection that's just causing that. Okay. Right, okay. Right, so I'm envisaging that this tooth is going to come out easily today. Okay. If at any point there is any pain, please try not to move, just pop up your hand, okay? Don't try to jerk your head from side to side or anything like that, because I just don't want to hurt anything in your mouth. Obviously you're going to be numb in the area, but other areas won't be numb. But we don't want to cause any damage because you're already particularly inflamed in there. Yeah. Okay, my lovely. Alright, just you relax and I'll just get the lidocaine ready. Okay. Right. So I'm going to be injecting the area. You'll feel a couple of little scratches and it'll go numb very, very quickly. So it will feel a little bit strange. Okay. You ready? Alright. Just open nice and wide for me there. Perfect. Just coming in now with the lidocaine. There we go. Sharp scratch, my lovely. Okay. Okay. There. So we'll just leave that a minute and then we'll just check to make sure you're numb. Okay. It's starting to feel a bit strange now. Just going to prepare a couple of things. Okay. Right. Let's check that now to see how you're feeling. Alright. Just open nice and wide. I'm just going to be touching around the area, okay, and we'll see if you can feel things. Okay, you can still feel that? Okay. Alright, I'll give you a little bit more. Everyone is different. Some people only need a small amount, some people need more, but we always start off with a minimum amount of local anaesthesia. Okay, alright, here we go. Just a little bit more. Just go around the back of that a little bit there. Okay. Perfect. Right. Let's see how that goes. I'll just update a few things again while we're waiting for that to go numb. Okay. Let's have another little look at that. Here we go. Can you feel that now? Okay. That's perfect then. We're all good to go. And get the final few few little bits ready there. The equipment is sterile, so I have to unpack it as I'm using it. Right, so I'm going to now extract that tooth for you, my lovely. So I need you to keep nice and still, keep your mouth as wide as you can, okay? I will be pulling a little bit on the side of your mouth just to allow access down here, okay? You might feel some pressure, you might hear some strange little sounds, some little cracking sounds. That's perfectly normal, do not worry. It doesn't mean anything's wrong, it's just the tooth coming away. Okay, have you had some teeth extracted before? Right, when you were younger, so you know what it sounds like. Okay, some people can be a bit alarmed by that. Okay, alright then, lovely. So, open nice and wide for me. Okay, I'm just going to come in now. And get around there. Okay, here we go. Just going to give it a little wiggle. Okay. You're right there, good. Okay. There we go. We got that. That's perfect. Okay. Let me can you just bite down on this now for me? Really, really hard. Bite really, really hard. Perfect. You just keep that there a second. You want to see the tooth? Okay. There it is. Just there. Just a little white tooth. Well, pretty white actually. Not bright white, but we don't like bright white. It's not natural. But there it is. It's all out. Okay. Pop that in there. Came out quite easily, didn't it? Yeah. Just keep biting on that for me a second, my lovely, and I'll take a check of it soon. Okay. Just have a little look at that. Alright. Bite a bit more for me. Okay. I'm going to give you this leaflet. It tells you all about the aftercare, alright? So the anaesthesia should wear off within about 3 to 6 hours. In that time, be very, very careful because you won't be able to feel anything in that area, alright? So we recommend don't have any hot drinks or food just because we don't want you to do any further damage or burn yourself, alright? We need that area to clot, so please don't rinse out or have spit out or rinse out for the next 24 hours while the clot forms over it. Okay, now you might need a painkiller later, that's fine, just take a paracetamol, alright? But in this leaflet it does tell you exactly what to do and what not to do. Okay, so try and avoid very hot food and hot drinks for at least 24 hours, okay? I know what you're thinking. I love my cups of tea, but, if you could have something tomorrow, yeah, try and avoid it today. It's all to try and protect the area, that's all. Okay, and certainly don't eat anything like hard foods, crisps, anything that's really hard and going to scratch that area and remove the clot, okay? You don't smoke, so that's not an issue. And alcohol, please don't have any for 24 to 48 hours. And please don't do any strenuous exercise because this can actually cause the clot to remove and to stop the healing, okay? Yeah, alright. And then after 24 hours, just use 1 teaspoon of salt in a cup of warm water, and then you can gently start rinsing that around your mouth and spitting that out, and that will help it heal. But don't do anything like that for the first 24 hours. Okay, let's just have another little check at that now. Okay. Alright, let me put that down there. Right, I'm just going to give you a little bit of suction, my lovely, alright? Okay, here we go. Not bleeding too much, actually. Yeah. Okay, that's more comfortable, isn't it? Okay. I'm going to have a little look, and I'll get you to bite down one more time. Okay. There we go. Let's have a little look at that. Yeah. I'm happy with that. That looks like a really good clean extraction, which is perfect. Okay, right, so I'm going to give you that in a second. I'm just going to get you to just bite down on this just for a little bit longer. We like to make sure our patients are leaving without any real bleeding. Okay. That wasn't that bad at all. No. Right. I'm going to send you away with one of these. This is a bite pack. It's a gauze. Okay. So if there's any oozing or bleeding, okay, you can apply this. You just remove it from its sterile packaging, moisten it slightly, roll it up, put it over the area where the socket is there, and bite really hard on it, as hard as you can. Firmly bite for about 20 minutes, and that should stem any bleeding. It's not uncommon for the wound to ooze or bleed a little bit for the first day or so. Okay. But that's why we have to be extra careful in eating or drinking, because we really don't want to remove that clot that's forming. If the clot does come away and the area is not healing properly, you'll probably start to get some discomfort and pain within 2 to 3 days, maybe 4 days. If that happens, please call us or just come straight back down, because that can indicate that you've got what we call a dry socket. Okay, and that's not good, because that can again get infected. That's not what we need. We need that clot to form over and heal nicely. Okay, so I'll give you this to take away. I'll also give you some of these as well. These are just what you're biting on now, okay? You can also give those a little bite if it's bleeding a little bit, if you don't want to use the bite pack itself, okay? Lovely jubbly. Right. Okay, yeah, I'm happy with that. That seems good. Right, let me take another check. That looks wonderful. Okay. Right. So I'm not going to ask you to bite down on anything else now for a while, but you take these little things away with you, and then you can always bite down, like I say, if it starts to ooze a bit. Okay. A little bit of blood, just spit that out, okay, but really don't rinse anything around there for another 24 hours. Okay, so are you feeling all right? Okay, that's perfect. Write up a few notes before you leave. Okay, you're back in for another check with myself and the hygienist in a couple of weeks. Alright, obviously, like I said, do come back if there's any problems. Okay, so I'm going to give you a little rinse out. There you go. Lovely. Okay. and pop that in there. Okay. There we go. That's a nice antibacterial rinse. Yeah, just a little wash just to get rid of what's sitting in your mouth there. But please don't do any more rinsing yet. Okay. Alright then, so I'll give you these to take away. I'm going to give you the bite pack to take away. And there's your leaflet about the aftercare, so you don't have to remember everything I've told you. Alright, just read it on the leaflet. And do call us if there are any problems, okay? So let me just remove your cover. There we go. Perfect, don't need that anymore. Alright, so I'll give you all of these, yeah? And the receptionist will see you before you leave. Okay, but any questions, do feel free to give us a call or pop back if there's any problems. Alright, my lovely. I'll take it easy for the rest of the day. Okay. Oh, you're going home and resting. That's perfect. Alright, so I'll see you again in a couple of weeks then. Alright, my lovely. Take care.